Thank you, everybody. My name is Jim Chaliak. I'm a tribal member of Nunapitchuk Village in southwestern Alaska. And thank you for giving us this opportunity to share a little bit of our research journey up to this point.
Thank you. And my name is Katie Cueva. I'm an assistant professor of health policy at the University of Alaska Anchorage. And Ayagufluk and I have been working together on a couple different projects. We'll focus mostly on one today where we're working in Ayagufluk's home community. But to get things started, I asked if you would say a few words where we come from. Often the oldest person in the room or the wisest person in the room will say things to get it started in a good way. So I've asked if he'll do that for us today.
Thank you, Katie. My name is Ayakushuk, born in Bethel, but raised in the village of Nunapitchuk. Yupik culture is very strongly adamant about giving names. Ayakushuk is given to me by my mother. She is currently living in Nunapitchuk. She's approaching, I believe, 90, but her given birth year is 1937. So, based upon census takers, that's what we live by. Nunapitchuk is a community of Yupik, predominantly Yupik, and of course there's non-natives bringing in the educational system too as well. But Nunapitchuk is quite culturally grounded into Yupik, so that our people practice seasonal abundance. Right now, ducks and geese are going to be the big thing right now coming in, and recently freshwater species of fish are coming into that river system we call Johnson River. But of course, in the Yupik way, it's a new way down at the mouth area of the Johnson, but then it becomes something else as you go up the river. So Ulayarak and Manwanakhlak and Kuijarak, respectively. So it goes up that way up to the watershed headwaters behind Calsgag. So that's where I come from.
Thank you. Thank you for grounding us, not only in who you are, but in the place where you come from. And so much identity is about where we are and our connection to the land. So thank you. Now, we're here today to talk a little bit about a partnership that we have to do research in this place that Ayagufluk was describing. And we came to that project because we were working together on another project called the Alaska Native Collaborative Hub for Research on Resilience, where we were looking at what things about communities really help young people to thrive, help support them, help to prevent them and protect them from suicide. So we work together with young people to help identify some of those factors. I don't know if you want to talk about that a little bit.
Yes, absolutely. So most recently, like last Monday, April 24, I work with wellness programming through YKHC Yukon Kuskokwim Corporation in Bethel, Alaska. And quite frequently, we get invited from school systems out there in the region. And Kasigaluk is a neighboring village from my hometown. It's only like 3 miles away from my parents' house. And the event coordinator with the school there, Gula Fox, he called and invited us to wellness programming from YKHC. And I couldn't say no. They held a week-long dance festival for the school district, Lower Kuskokwim School District. And they invited, I believe there were around 250 junior and senior high school students gathering there to do their dance performance. They bring in their expertise from their home communities and perform as individual community dance groups. And then they also dance as a universe for the school district. So it was amazing. It was an amazing experience. One of the requests the homeschool coordinator there made was suicide prevention. And gladly we take what our people ask for. But when we come to our elders, our resources, to pull these cultural and practical strengths for our people from our people, they say yes too. But then they frame suicide prevention as the way we love, meaning what do we say to young people in order to lift them up? What do we do and how do we care for them in order to help them deal with this day and maybe move on to the next day? So things like that.
Mm.
There's another aspect to youth suicide risks and prevention that is building upon health research. And elders ask, what's data?
Mm.
And that's a hard one to explain to sometimes,
Mhm.
especially to our older folks in the region. This little old lady asked me, so what's this? Ayakurip manajawa data. I couldn't answer her right away. I have to think this over. So when my mind wrapped this up around data and the way she might be thinking about it, I said, you already have data. You carry it with you everywhere you go. So because, practice-based evidence is what they mostly our elders speak upon, is rather than evidence-based. These two frameworks can work together. And in my way of thinking, of course, it's a complex system. But back to the elder, when I said that to her, you carry data around. These folks are coming in from the outside because they don't know what cultural strengths might support our young people. You already know how to take care of us, and you've been telling us over the years. So her mind got into that framework, and she didn't have to ask me what data was anymore.
I think
So,
that's
yes, health research is a really, really complex approach to argue the culture and what can be helpful and how can we make two ends meet and make it work better for folks out there.
Yeah, I think that's a great example for people out there listening in of, this talk is called The Power of Community, and really that people in communities already know what's working. They already know how to love their young people. They already know how to take care of themselves. And so me as a researcher, if I'm not from that place or not from that community, my job is really to listen and to help support what's already working, because the power is there. Maybe there needs to be some other structural things that can be adjusted, and I can help with that. But really, that I'm not bringing any power into the community. It's already there. I don't know if you have other ideas about.
Yes, yes. We welcome people like you into the community. I do. There has been this stigma of health research in Native communities, I believe, across the state for a long time. But there is this health research happening across the state up to this day, and I think it's taking better and better form because cultural and Alaska Native knowledge is taking its place in health research, and we're working together more and more. However, I welcome your presence wherever we go. I welcome your presence and your expertise and your health research skills. And so to other folks who are taking keen interest in this work. The way I see the value behind that is you inspire us, you inspire me personally, but I also encourage our Alaska Native folks out there to look at this vast, broad landscape of algorithms, ways to measure this or that. And how does that relate back to that little old lady elder asking what's data? Well, I can make connections to the way we interpret these numbers. Maybe there's a gap analysis that tells me how much information is missing or what's best to deliver in a way of service, sometime in the future. In the present, Alaska Natives know how to take good care of themselves right now.
Mhm.
It's just that we sometimes need reminders. Yes, colonies and a number of other different barriers causing issues of misunderstanding and misinforming each other. So these things come into play. And that's where I like to take the value of health research and help us define our issues in a little bit different way, but come to a common goal and set up some strategies to work towards that goal.
Thank you. And we may have to adjust computers. My computer is having some challenges this morning, so we may jump over to Ayagufluk's computer here in just a couple of minutes. Maybe he'll set that up and I will chat just a little bit about my experiences with one of the projects that we are currently working on, which out of the partnership that Ayagufluk was just talking about to support young people, we started to investigate a little bit about the impacts of COVID-19. So we went to the community where Ayagufluk is from. And one of the things about working with community members is to be really respectful of what it is that they would like you to do. So when I first approached Ayagufluk about this project, he helped us to choose which communities we would go to. So he told us that there were some communities that he had in mind and approached their tribal councils and didn't necessarily get a good response. That wasn't something that was a priority for them. So we ended up going to a community where that was something that they really wanted. They wanted us to be there. And it was, for me as a researcher, having somebody from the community who knows the people is invaluable, not only because Ayagufluk speaks the language and I don't, so he's able to communicate that to, especially to people who don't necessarily speak English, but he speaks the culture and I don't. So when I ask a certain question or when we talk about what questions to ask, maybe the way that I read something comes across one way, but when Ayagufluk reads it, it doesn't come across the same way. It needs to be fixed so that people in the community will understand it better. And that's both when we're talking about what questions we're going to ask at the beginning and also when we get there in the community. And we're in person with individuals and maybe they have some questions. He can help clarify what exactly we mean by that, if those words are not resonating with those people. All right, and it looks like we are up on the other computer, so give us.
Yes, we spent a little bit of time with our finding a tribal council who was willing to appreciate the work behind COVID-19 and studying the impacts behind and how each of the communities lived through it. So we ended up with one of them two we visited was my hometown in Apichak, and I appreciate the tribal council there and the city government. So there's two different governance forms up there, but they worked very well together. So do many other communities in the YKC region. The other community was Bethel, and they have a Native Council there. They go by Ojogahami Native Council, and we give each other acronyms. ONC belongs to Ojogahami. YKHC belongs to Yukon Health Corporation. Mm-hmm. So ONC and the Native Village of Nunapachik both agreed to allow us into their community. And that was one of the first steps I like to try is to engage the community and ask kind of a permission to enter their community and conduct these forums. And that was a great way. I believe group forums that we did was key to the people feeling safe. It was key to have them share some food and beverages as they came through our focus groups. And I believe that's one of the success factors in health research is we make the people feel welcome into their space, into your space, into my space, into their space. So food and beverages is one of the key ways we connect as a people, no matter where we go. If I have a bottle of water, we share. Inviting others to a cup of tea is common. So, and I believe that's global. In Bethel and Nunapachuk is the same. People invite each other and support each other in small acts of kindness, so to speak. But it's something that's been practiced for thousands and thousands of years. People taking good care of each other. It's always been there. The spirit has always been there. But when somebody is coming in from the outside to do health research, flags should rise up. But we're here to, I'm here to help deal with some of those flags and hope to come to a point where we do meet, we do understand where we're coming from. Share your stories, where you come from. First of all, introduce yourself, name your family. That's a unique way of introducing ourselves. So, like for myself, I'm on my Akushik, so I just name my parents, my mom, and my late father, Chuck Taliak Sr., who is his Yupik name, and I can go a little bit deeper. I can dive into a little bit of my family tree if I could. But things like that are important to share a little bit of yourself, whether it be personal, and especially if it's personal, a little bit of your family background. In the Western way of introducing yourself, you name yourself and myself, Jim Chaliak. I work for YKHC, But even that, I believe it's really important to be able to help make our target audience feel safe in that space. And then we take off. And we noticed as we were doing our questionnaire, our structured questionnaire, I believe the response was really powerful in that way because they felt safe to begin with. And it grew from there. I felt that there was that spirit of community already in there. We just tapped into it a little bit to make it happen. And it did.
Yeah.
It's still happening. Yes.
I guess some of the things that resonate when you talk about that too are, the way of engaging, like what's culturally appropriate, that it's a culturally relevant and appropriate way to do research with the community by sharing food. Now, that's the way that we begin each of those focus groups, is offering food, offering beverages, to invite people into that space and feel comfortable in that space. Also, when we talk about working with the tribal councils, that they have to invite us in. They have to welcome the research. And the tribal council also said, that's interesting. Could you ask these questions? We are really interested in knowing the answers to these questions. So then we were able to ask those questions of the people we talked to and share the responses back with them. So it's really helping to address their needs.
So the tribal councils do have a little bit of ownership in the beginning, but then they start owning a little bit more into the process to a point where ONC Bay and Nunapachuk both asked questions for their own community. They wanted to know a little bit more of this and that. And yes, we then start working together that way. And I thought that was an amazing thing to see happening, because I haven't seen that for a long time. People working together, especially on COVID-19 and impact. What did we live through? And when we started receiving these responses back, one of the strong identifiers that I felt was both ONC, Ojibwa community, and the native village of Nunapachuk participants pointed back to their own cultures. their own Alaska Native cultures. What did they start seeing for themselves during COVID-19 and living through it? And I think the primary response there was, we're practicing our culture a little bit more today than before. And I thought that was amazing. People coming together. Because that power of community has always been there. Yes. And now we're working together with other folks from a global standpoint, so to speak.
Yes.
Yes.
That's one of the other interesting things about this project. So we worked with 2 communities in Alaska, but we're part of a community in the circumpolar north where each country in the north did a case study in their own communities. And we got together at Dartmouth in April, so not maybe in March, end of March, not too long ago. And we each shared what we were learning in our own context. So Ayagutluk and I talked about what we were learning in Nunapachuk and in Bethel, and the folks from Sweden shared, and Finland and Norway, Greenland and Iceland and Canada. Yes. And as we were listening to all these different presentations, we were listening, all of us, for are there similarities or are there differences? And going into it, I thought that things would be very different. I mean, the governance structure in each of these places is very different. And Iceland doesn't have any indigenous people, so that's quite a big difference. But after we had shared, we kind of all looked at each other and said, there's a lot that is very, very similar. And the top theme as a group were starting to list what we thought was similar was the power of community.
Yes. So listening to that group, several different countries, it was just amazing to hear and feel our common humanity. That's what I felt. And to come back home and think it over, and then attending these other different meetings up to this point, those labels from different measures conducted by this agency or that agency, 26 in that one and 50 something in the other one, all of those labels, I want to make it as simple as I can. It's labeling who I am. Alaska Natives tend to be clustered with American Indians, but quite literally, we're different people. We do similar things, just like that group of 7 countries we met with. We're different groups of people, but our studies and finding the results from our studies connected me with everybody in that room, both Alaska Native, myself, non-natives from across the globe, Arctic Circle, Arctic circumpolar north. It's just quite amazing. I came home. It felt like that was a sign of spring. Another sign of spring to begin the season of abundance for our home region. So for me, this landscape of health research and algorithms and funding formulas and so on and so forth, to me now means in Yupik being a Yupik word being a is always being prepared. So how do we take this health research and all the outcomes that we're finding and seeing the commonality across the globe, in our case, circumpolar north and between Nunapachuk and ONC, how do we take that information and share it back with the councils and maybe throw some ideas around to being prepared for, another emergency crisis, pandemic-wise or otherwise.
Yeah, there's so much to learn there. And I like that idea that really our research is just a way to help us be prepared. And, as I'm hearing you talk to, from a researcher perspective, it's so important and so essential to learn from communities and be in partnership with communities. And I wonder, from where you sit, both as a researcher and as a community member, why do research? Why engage with those of us who are not from there?
Yes, and one of the points I'm seeing now is just what I said. There's a broad landscape out there of so many different algorithms, so many different ways of measuring health, for example. Public health is something that Alaska Natives can take a little bit more ownership, take a little bit more definition, defining who we are and defining that policy behind who we are, so that healthcare can become a little bit more real and connected to our culture of who we are, no matter which culture we come from. And that's what I believe is, if we want to be the healthiest people in the world, I believe we can ground ourselves back a little bit more, including policy, health research, and all those algorithms. That's what we need out here in each of our own communities.
It sounds like some of it is, when stories are told kind of in an academic way, that they speak to those structures of power and they cause change. Maybe the policies change or the healthcare systems change. And so maybe the benefit that we have, if I'm hearing you right, is that we can tell the stories that are already there in a way that other people will listen to.
Yes, yes. The more we have lending ears to listen, the better we are going to be. We need help. And what better to do it, to help each other when we have the resources. We have this new knowledge coming in. Alaska Natives have so much knowledge to begin with. All of it was orally taught. A lot of it was never written before until recently. And I believe we can cross bridges and build more into our future. Our grandchildren are coming up. We need to come to them bear gifts. Besides Manukastok, besides birthday cake, we need to bring them gifts of knowledge. A combination of Yupik, Aleut, Inuit, all across Alaska, knowledge. But paired with whatever health research positive outcomes we can gather and combine it in a good way for our grandchildren.
And that's such a heartwarming way to think about research, that we are the ones who are creating the gifts to give our children and our grandchildren.
Yes.
And I know that we have just a few minutes left. If we can check in with our moderators, if we should have time for questions here.
I think you should take the time to finish your conversation. We had actually we thought that you would just talk with each other. And I don't know if there are any questions in the chat. I'm going to ask my colleagues.
All right. We will take just a few minutes to finish things up, and then we will pass things back to Gwen. So, I'm not sure if you have any closing thoughts.
Yes, I just want to express my gratitude to both Katie and the rest of the health research community that I've been associated with. I also want to thank my University of Alaska Fairbanks advisors, instructors over the last few years. They've been such an amazing group to inspire me, and looking forward to new opportunities into health research. You and a number of Mallory too included have brought me to a place where I had never imagined myself 8 years ago. So I want to express that gratitude. And lastly, my ancestors and my mother and my dad and everybody else who's been supporting me in their own unique way. Rihanna Jack. Thank you very much.
Thank you. And I feel like that just warms my heart, that a way of thinking about yourself. We did an exercise when we were working with young people, is to think about the 7 generations that came before you and how they stand behind you, and you are a result of all of their love. And then to think about the 7 generations that will come in front of you. So what are we doing to prepare for that? And I really feel like this kind of work where we bring people together help to better understand how people love, how grandparents are loving their grandchildren in ways that support them, how parents are loving their children in ways that set them up well for the future, and how do we have more of that? Just helps to make communities and individuals in the world a better place. So thank you for being a part of that. And thank you for having us and hosting this conversation. And we'll turn things back over to Gwen.